Okay, so for this case, I thought we would practice just looking through a trauma case together and seeing how we can use dictation to and templates to really speed up reporting. So I'm just going to dive straight into this CT kind of trauma, CT chest, abdomen, pelvis with my dictation running, and we'll go through it together. Patchy consolidation within the left upper lobe concerning for pulmonary hemorrhage. There is high attenuation stranding throughout the superior mediastinum with a irregular contour and outpouching of the aortic arch within the region of the ligamentum arteriosum. Appearances are concerning for a traumatic aortic pseudoaneurysm with mediastinal hematoma. There is a left diaphragmatic rupture with herniation of the stomach into the left hemidiaphragm. There are fractures of the left 11th, 10th, 9th and 8th ribs. Fracture of the left transverse process of L4, L3, L2. Fracture of the left inferior pubic ramus. Fracture of the right superior and inferior pubic rami. Complex right sacral alar fracture. There is a large laceration involving less than 25% of the right hepatic lobe. There is no evidence of active contrast extravasation from this site or hepatic vascular injury. There is a small laceration of the anterior spleen extending 2 to 3 centimeters into the splenic parenchyma with no active contrast extravasation or evidence of significant splenic vascular injury. There is hematoma within the retropubic / prevesical space and along the right pelvic side wall, consistent with the known pelvic fractures. There is stranding within the soft tissues of the left flank and across the lower anterior abdominal subcutaneous fat, in keeping with a seatbelt pattern injury. No intraperitoneal free fluid or gas. No evidence of bowel perforation. No evidence of an unstable vertebral fracture. The rest of the scan appears normal. Okay, let's try this. So I've asked RadCoPilot to convert that dictated text into and fit that into my trauma template, which I've kind of pre-designed myself. And let's see what it's done. Okay, so it's done a pretty nice job of that thoracic stuff. Let's have a look at the pelvis. Okay, so it's got liver injury and spleen injury. Pelvic fractures. I guess we should specifically comment on whether on these delayed phase images there's any evidence of extravasation of contrast from the bladder, suggest bladder injury, and we can't see anything of that, so let's add that in. No extravasation of contrast from bladder on delayed images. And this probably shouldn't go in retroperitoneum. Perhaps we can put that in additional findings. Get rid of that for now. Okay, MSK, sacral injury. Okay, let's say sacral alar fracture. Right, so and then let's see what it's got in conclusion. So traumatic hematoma. Great. Okay, now what I would like to do is, can you help me give an AST grade for the splenic and liver injuries? So for the spleen, it's giving me grade 2. Yeah, that seems to fit with the description. And then for liver, it's grade 3, laceration greater than 3 cm parenchymal depth, but less than 25%. Yep, okay. So let's put that in. Fantastic. Okay, let's finish our report there.